Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Okay. Hello, everybody. Welcome to Pharmacist Fridays on Daily with Doc and Becca. My name is Becca Dukes, and I'm excited to have you here with us as we are sharing more information by answering your questions. So yes, it is Pharmacist Fridays. We have the amazing Pharmacist Ben Fuchs with us, as he's like a trailblazer when it comes to marrying nutrition and pharmaceuticals and skin health and just putting it all. He got muted. Here I was on a roll. So I'm not quite sure where I got muted, but folks, we're in for a special treat as we have a trailblazer in the nutraceutical, pharmaceutical, and skincare areas of life, where he takes a different look at health, and he goes from the inside out to make the outside look fabulous. So I am talking about the one and only Pharmacist Ben Fuchs. So he's going to be doing questions and answers today. So if you have questions, folks, and you'd like to join us live, make sure that you do so by going to zoom.dailywithdoc.com. Again, that's zoom.dailywithdoc.com. And if you're out on a YouTube or Rumble, we do have team members that are watching the chat there. You can put your chat questions in and they'll bring them into the show as well. As yes, this is a live show. So if you're watching the live show, live stream, make sure that you use that chat. If you're watching a live stream on any of the platforms, like us, follow us, and let us know where you're joining us from. We love to know the reach that we are expanding as we grow each and every day in helping others find information that they probably won't find in any medical clinic. With that being said, this program is amazing. We're not stupid. Ben, you're going to be proud of me, as we are individuals who can make choices for ourselves. And the information that you receive in this program is educational. So use it. But it does not take the place of your primary care physician. FDA requires us to say that. So without further ado, if you are invited by somebody specific, make sure if you have further questions to get back with them. They cared enough about you to invite you to this program because they know that you're going to learn something that is going to flip that switch as to what might be missing in your health journey. So without further ado, it is my honor and privilege to bring to the screen with me Pharmacist Ben Fuchs. Hello.
Hey, good to see you, Rebecca. How do you like my tie here?
I love your tie.
All right.
Yeah.
Thank you. So let's see. I definitely want to take questions and answers. I'm going to try not to talk too much because we always run out of time. But I did see this article that got my attention. I just want to talk about it real briefly here. This is an article from Good Housekeeping magazine. Okay, not exactly a hotbed of hot research and scientific information, but it caught my attention. The headline was how to combat inflammaging, the aging side effect nobody talks about. The whole idea being that inflammation is the cause of aging, and inflammation, they didn't even say the cause of aging. They think it might be the cause of aging. It's a concept. We're still looking. Dr. Ian Neal, associate clinical professor of medicine, says we're still looking for what leads to age-related changes in the body. They just got to come on the call with the Daily with Doc call and save them a lot of time. We know that people with multiple medical problems have higher blood markers for inflammation. Surprise, surprise. Ever hear dirty blood? Higher inflammation levels tend to be correlated to higher disease levels. Oh, what a smart doctor. Oh my gosh. He says inflammation is behind disease. Brilliant. Oh my God. He says inflammation in the blood is the cause of disease. What a genius. I'm teasing, of course. Yes, it's all inflammation. Don't wait for your doctor to say anything. Don't wait for you to read it in a magazine or see it on the news. It's all about inflammatory issues. But what the heck is inflammation? And we throw that word around all the time. What does it really mean? Simply put, inflammation is a protective response. It's protection. Stick that in the back of your head here because I want to get back to that. But before I get to describe the whole nature of the protective response and why it's so important to understand and how we can leverage it to feel better and to slow down the aging process, we got to talk about two kinds of inflammation. And this is where it gets tricky. There's inflammation, which we all think of when we hear the word, which is the kind of inflammation you get when you get a black eye or a broken leg or sprained ankle, which shows up obviously as a big knot or a black and blue spot. It's very obvious, this kind of inflammation. You can see it. We call that macro inflammation, meaning big inflammation. But where it gets tricky is there's a whole nother kind of inflammation, which is called the same idea, but it happens on a microscopic level, at the level of a cell. This is microinflammation, and this is the kind of inflammation that's associated with inflammaging and that everybody talks about when we talk about inflammation and diseases. It's the microscopic inflammation that we don't see. Go about our business all day, but we're micro-inflaming inside our body. And because we don't see it, it comes as a complete shock to us when the inflammation, the microinflammation, reaches a critical mass and tips over into a full-blown symptom. And we say, I'm just sitting here minding my own business, and all of a sudden I got arthritis. And even if we don't say it, we think it. I was fine yesterday. What happened today? What we don't notice is the microinflammation because it's happening microscopically. And this is why brilliant doctors are so amazed, like Dr. Ian Neal, feel like they made such a wonderful discovery when they realize, oh my God, inflammation, that might be behind disease, because they don't know, or they haven't seen, or they haven't thought of the fact that this stuff is percolating underneath, for some people, from the time they're born, even possibly in utero, in the womb. It begins very, very, very early. Now, what exactly is this thing called inflammation? So it's a defensive response. So what's it we have a defensive response, and what's it defending against? And that's really the only question we have to ask. When you have a defense, and by the way, this is all logic, no medicine here, no science here, logic. If you have a defensive response that you want to end because it's causing problems, what's the logical question to ask? What's the offending agent? You can't have a defensive response without an offending agent. You don't have defense without offense. They go together. If you have a defensive response, by definition, there's an offending agent. And if you want to end a defensive response, eliminate the offending agent. Sounds simple. And it is simple. That doesn't mean it's easy. Because unfortunately, we've created a world where we are immersed, saturated, drenched from the outside in. From the outside of our body to the inside of our body, immersed and drenched and saturated in offending agents. And for the most part, the large majority, the bulk of those offending agents are coming in through food. And I got to tell you, I feel so embarrassed talking about food in the digestive system all the time, because I know there's people out there rolling their eyes and they're thinking, oh, that's all Ben talks about. And I know I've heard people say that about Dr. Wallach, gluten this and gluten that. You know, but it's just important to understand that that's the main place that offending agents get into the body. It's not because we're foodies. And food is very tricky because we take it personally. By the way, you never want to talk to somebody about their food. How well does it go over when you talk to somebody about their food? Have you noticed? Do people want to hear? Nobody wants
Not
to hear.
very well.
Nobody wants to hear about their food because deep down inside, we know what we're doing is not right. But if you're serious about health, or if you're serious about recovering, if you're serious about getting health, this is a power point, a leverage point. Remember, the most important invention ever is the lever because a little move gives you a big result. This is the most important leverage point. Inflammation is behind everything. Inflammation is a defensive response. If you have a defensive response, you got to figure out the offending agent. If you want to end the defensive response, the most important offending agent is food and / digestive system, because sometimes it is the digestive system, particularly the intestine, as well as other parts, but especially the intestine, where you run into these problems. So inflammation is the key. It's behind everything. I have the triangle of disease, that the mechanism of action of the triangle of disease, or the impact that the triangle of disease has on health and wellness mechanism, is the inflammatory response, because it happens microscopically. We do not see it, but over the course of time, it accrues. Now, I'm not sure if I've done so many calls and Zoom calls. I'm not sure if I said this on our last call or who I sent this to, but there's a way that this whole thing happens, and it involves pockets of inflammatory barriers or walls. Did we talk about this last week? Rebecca, help me out. I don't want to repeat.
No, we didn't.
So when the enemy, we'll just say the enemy, inflammatory foods get into the bloodstream, eventually they're going to get dumped out of the bloodstream. By the way, the dirty blood issue that we always talk about, or hypercoagulated, hypercoagulatable blood, that's a fancy way of saying it, I call it dirty blood, is initiated by toxins that get into the bloodstream. Toxins that get into the bloodstream are their own problem, and inflammatory reactions happen in the blood itself. The blood is a tissue. It's liquid, but it's a tissue. And so you have inflammation in the blood. You have this protective response in the blood. Eventually, that inflammatory response, or the immune cells and the inflammatory factors, get dumped out into the soft tissues in the various parts of the body, where they can wreak havoc on cells. You got to understand, the body, the cells, and the blood are tightly regulated. They're super, super, super controlled. Everything is just so. And yes, there are mechanisms in place to adjust, but once you start disturbing things with immunity, inflammatory factors, foods, bacteria, you throw everything off. And so once these inflammatory factors get into the blood, they disturb blood chemistry. That's the road to all disease. But eventually some of that toxicity will get dumped out into the blood. This disturbs cell chemistry. Cells start to die. The inflammatory factors then wall off the area where there's the dead cells. That's what the microinflammation really is. It's a wall, or a protective mechanism that segregates the dead cells. When cells die, they don't just die. They explode, and they spew out their contents. Enzymes and acids, which they're loaded with. And these enzymes and acids are very dangerous. They can eat things up. And so the body protects against these exploded enzymes and acids by walling off the cells. It's great if it happens once or twice or 3 times. But when it happens chronically, you get these chronic walls. You get lots of walls, lots of pockets. And these walls are great for a protective response, but in the long run, the walls will prevent food from getting through, and oxygen from getting through, and nutrients from getting out. So all of the collateral cells that are okay, they're not going to get any food. You're walling off the cells that are dead, but as these pockets walls start to build up, you get these pockets where cells don't get fed and oxygenated and detoxified, and then they die, and then you get more inflammatory factors, and then you get more pockets, et cetera, et cetera, et cetera. And this is the cascade of the inflammatory related death of cells. And this happens over and over and over again as offending agents get into the body. And it happens over the course of days and months and years and decades, and that's where disease ensues. Listen, that's not complicated. The enemy gets in. That's it. We got to figure out how the enemy gets out, and that's where food comes in. So what do? Food diary. Boom. Everybody. If you're a longevity rep and somebody comes to you and they got health problems, food diary. What does that do for you? Number one, it demonstrates to the patient, the client, the customer, the connection. They'll see, because when you stop the offending agent, the symptoms will begin to resolve. When you stop the flow of offending agent. That's why everybody notices benefits from fasting. The extent you fast, 1 day, 2 days, 3 days, the more you fast, the greater, the more dramatic the symptom reduction. This happens all the time. This, for longevity reps or for consumers, this shows how powerful introducing foods into the body is when it comes to your symptoms. How powerful a corrective measure, stopping or cessation of this offending agent is. Sometimes it's an incredible epiphany for people. Oh my God, every time I have corn, I get tremors. Every time I have wheat, I bloat. Every time I have bread, I get a rash. This is an epiphany for people. So number one, for longevity reps or for customers, when you do food diary, this shows people that there's this connection. You're not lost. It's terrifying for people when they have these symptoms. They don't know what the heck to do, and the doctor doesn't know what to do, and nobody knows what to do. It just looks like they're coming out of nowhere, but now you got some control. This also, for longevity reps, vests the client in their health, which is what you want. You want the client participating. You don't want to be just saying, take this, take that. If a client who participates in their health is a better client, and that's what you're looking for. And number three, it just works. It just works. The client's going to get better. So for multiple reasons, you have the client start off with a food diary. They write things down, then they see how they respond. And then they notice the foods that are causing problems. It may take a couple weeks. It's tricky. It's not, there's a process that's involved. It's a detective game. I call it biological forensics or health forensics, because it's like CSI. You're trying to find a perpetrator of a crime by tracking down clues and following them, backtracking. This is what doctors should be doing. This is what medical professionals should be doing. Make no mistake about it, but that's not the culture we have. This is how you want to do it. You want to look for the perpetrator of the crime. And then you start eliminating foods. When you start to eliminate foods, typically the client will start to get better. But there's other things too. You have to strengthen the digestive system. Longevity excels. Longevity's got thousands of products, but their digestive products are awesome, starting with the I-26 and the Fucoid Z, which is a very powerful intestinal strengthening ingredient. Fucoid Z. Nobody talks about that. We talk about it here, but you don't hear about that a lot. Collagen peptides, likewise. Daily Digest, Ultimate Microbiome, Nightly Acid. There's a whole slew of them. Dr. Ariaz's Liver Cleanse. The liver is a digestive organ, among other things. It does many things. By the way, the liver is command central for biochemistry in the body. Metabolic syndrome, which affects the liver in many ways, largely affects other things too, but the main source of the main site of attack of elevated blood sugar and dysglycemia is the liver. Once you're into metabolic syndrome, everything gets thrown off, and the liver is partially a digestive organ. So you look for problem foods, eliminate them, you start strengthening the digestive system, secondly, and then you practice regular intermittent fasting. Why? For two reasons. Number one, fasting, when you stop eating, your body cleans itself out. It cleans itself out on two levels. It cleans itself out on a microscopic level. That is, it cleans out dead cells, dysfunctional cells. That's called autophagy, fancy name. And it cleans out the digestive tract and the bowels and the colon through the migrating motor complex, which we've talked about earlier. So when you fast, you clean out your bowels and you clean out your intestine and you clean out dead cells. So working on digestive health is the first and most important step. After that, you can start doing other things. Blood sugar control is very, very important. Ketogenic diet, low calorie, staying away from processed foods and sugars, all are very, very, very important. And the last thing I'll say, one of the most problematic substances that we put into the body, that we eat, that we ingest for the intestine is fried fats. Fried fats are pro-inflammatory for everything. In fact, that may be the most inflammatory substance that we ingest, may very well be processed and fried fats, which docs have been talking about for decades, as have I. The fat system of the body controls the inflammatory system. The inflammatory system of the body is mediated and controlled by fats. So once you ingest the wrong kinds of fats or have issues with fat absorption or fat malabsorption, bile, liver, intestinal issues, pancreatic issues, you're off to the inflammatory races because that throws off inflammation. Fried fats are especially inflammatory for the intestinal lining. So laying off of fried fats is also important, in addition to, of course, the stuff we always talk about, the lectins, starring gluten. And I know I say this all the time. Last thing I'll say here, gluten is one of 1,000 different lectins. So yeah, you're gluten-free. And the reason I bring that up is because people say, oh, but I'm gluten-free. Well, yeah, but there's other lectins or defensive molecules in plants that you could be that you could be interacting with and ingesting. And to say, oh, I'm only eating gluten-free brownies, only gluten-free pizza, I only eat gluten-free bread, that doesn't mean anything because there's all these other things that you could be interacting with. And then one last thing is if you inject things in through your skin into the blood, that's another way that the blood can become hypercoagulated. And anybody who has even a whit of understanding about biochemistry, a drop of understanding about biochemistry would know that you don't inject things into the bloodstream, or if you do inject things into the bloodstream, you're running a risk of hypercoagulability. That means dirty blood, which means blood clots. And oh, surprise, surprise. What is the side effect and the toxicity associated with the big V that everybody wanted to force us to take? Dirty blood, clotted blood. If you had a drop of understanding about biochemistry, Dr. Whatever, no names, you would know that you're going to clot. You're going to have blood clotting when you start sticking foreign substances into your body, into the bloodstream through the skin. All right, that's that. I hope that was not too much. And I really want to simplify everything, so I hope it wasn't too complicated. It's all about the food and the digestive system.
Okay, so we have a question coming in from Spotify wanting to know, how long should we fast?
40 days is a good.
40 days?
No, I'm just kidding. Jesus did for 40 days. It worked for him. No, I'm just kidding. Jesus. Whatever you do, you can do. The longer you go without eating, the better off you are, but you got to eat. So you decide, the longer you go, and it doesn't have to be, fasting's great. Cessation from food is great, the best, but just calorie restriction will make a difference. The average American eats between maybe 2,500 and 3,000 calories a day, and many people eat 4,000 and 5,000 calories a day. You need about 800 to 1,000. You'd be just fine. You won't suffer. You won't starve. You won't be uncomfortable. Mentally, maybe a little, because it's addicting. And there's mental reasons why we eat, but from a physiological perspective, if you eat the right foods, 800 to 1,000 calories is low calorie, ketogenic, and it's not uncomfortable. So a day, 2 days, you have to decide where that is. Everybody's going to have their own place, but 24 to 48 hours is a good place.
Okay, and the next question is, while I'm fasting, can I take my supplements?
Great question. Okay. Yes, you can take your supplement. When you're fasting, what you're doing is you're fasting from calories. You're giving your body a break. Supplements have no calories. Supplements are the active ingredients in calories. Now, when you say supplements, I'm assuming you mean micronutrients. The TMR shake and such, that's not the same. But the micronutrients, the Mighty 90 essential nutrients, that's not a problem. Now, some of the nutrients might be a little hard on the stomach without food, so you have to play around with that. And sometimes it's better to take supplements with food because the digestive juices are going, so it's easier for the body to process. But from a fasting perspective, you're not going to hurt your fast by using supplements.
Okay, and the next question: doing the fast, taking supplements with the presence of blood clots, is there anything additional nutritionally that somebody should be taking in?
Okay, so if they have blood clots and they're fasting, is there something else they should do? Is that what you're saying? Is that what you're asking?
Yeah. So they're
Fluids.
taking the Mighty 90.
Fluids. The
What?
blood.
Anything else?
Yeah, fluids. You want to liquefy the blood as much as possible. That's why fluids are so important. That's why water is so important, or BTT is so important, because it fluidizes the blood. The blood, the blood's really interesting. I'm doing a series, by the way, on dry skin. I found this really cool way of sending video emails. I'm sending video emails to my, I'm in the skin business, so I'm sending video emails to my skincare customers and my estheticians. I'm talking about dry skin. And I don't want to, I don't want to ruin the surprise here. As they say, what do they say? How do they, forgot how they use, what's the term when you tell the ending of the story? I forgot what the word they use is, what the term they use. You tell the ending of the movie, and it's an alert, some kind of alert. I forgot what they say, what the alert is. Anyway.
Foreshadowing?
What is it?
Is that foreshadowing, you're saying?
No, there's an alert. The word is alert. Spoiler alert. That's it. Spoiler alert. I don't, this is a spoiler alert because I'm trying to do the series and kind of, bring people in. But I'm gonna tell you, I'm doing a series on dry skin. All right, everybody has dry skin. Dry skin, it's endemic. If I ask people to raise their hands on this call, I'm sure 90, if not 100%, 99, if not 100% of people raise their hand, say they got dry skin. Everybody has dry skin. But at the same time, everybody has we sell $10 billion in moisturizing creams in this country, and everybody has a moisturizer everywhere. In their purse, and in their locker, and in their office, and in their car, and 2 in their medicine cabinet, and 3 in their desk in the office. Everywhere. How many moisturizers do you think you have, Rebecca or Marilyn? It's usually women, but men too. And people are putting moisturizers everywhere, but they have dry skin. Okay? Because it's not a moisturizer issue. What is it that makes the skin nice and moist and soft? The same thing that makes everything in the body, the cells of the body, nice and moist. Not necessarily soft, but hydrated. How do we stay hydrated? Through the blood. The blood is responsible for hydrating us. In terms of the skin, the blood goes to the skin, to the bottom of the skin, and it releases water, and the water goes upwards. The reason everybody has dry skin is because everybody has dirty blood, because the blood is hypercoagulated. It's not moving effectively. This is the same thing with the rest of the body. So fluidizing the blood is extremely important, number one. And then, this is also really cool, electrifying the blood. The red blood cells, which make up a large part of the blood, have electrical charges on the outside of them. And as toxicity enters into the bloodstream, the blood cells start to clump up. And if you look, there's actually something called dark field microscopy, which some of you guys have heard of, where they can actually look at your blood cells. And doctors don't use it, but alternative practitioners use it. And they'll look in your blood and they'll see it's all clumped up. The blood cells all clumped up. By putting electrical substances in the blood, you can actually spread everything out and improve fluidity. In fact, if you go get surgery, they'll cut you open. And one of the first things that happens when they cut you open is your blood clots. Why is that? Why does your blood clot when you go into surgery? And you're more prone towards clotting after surgery. Why is that? Well, when you get cut up and you're on the operating table, your body doesn't know you're on the operating table. Your body thinks you're on the African savannah and you just got bitten by a lion. A wild animal's eating you. It doesn't know there's a surgical procedure happening. So the body has evolved a mechanism so you don't bleed out all over the African savannah. So it clots the blood. So clotting of the blood is associated with the stress response. That's why when you get stuff in the blood, you clot. The stress response will clot the blood, and surgeries are notorious for clotting the blood. So what do they give you to keep your blood from clotting when you come out of surgery? Or what's the first thing they give you? Or they give it to you for a couple days after? Say it. It's called.
Well, they give you saline, but
No.
you thinking
they give you heparin? Heparin.
Okay.
All right, you guys have all heard of heparin. What's heparin? Heparin, that's actually heparin sulfate. It's a polysaccharide with lots of electricity. Polysaccharides have lots of electrical charges. You stick it in your blood, it spreads everything out. Fucoidan does the same thing. Ionic minerals do the same thing. Hyaluronic acid and glucosamine do the same thing. You spread out the blood cells by interacting electrically, and it spreads everything out. It's another way to fluidize the blood. So making sure you're keeping the blood fluid is the key to preventing yourself, to preventing blood clots. And if you're fasting and you're worried about blood clots, first of all, you probably have less because now you don't have toxicity coming into the clot initiating toxicity coming in through the intestine, like make sure you're using your Fucoid Z. Make sure you're using your Gluco-Gel caps. Make sure you're using your ionic minerals, and also veggie juices, which have polysaccharides in them. And make sure that you're fluidizing the blood with liquids. So when you're fasting, drink lots of water, and that'll help fluidize the blood. In fact, we should all be fluidizing the blood all the time. First thing in the morning, the blood tends to be thicker, by the way. And for diabetics, sugar will also make the blood sticky and sludgy and interfere with the blood vessels as well. And so fluidizing the blood is also important, especially important for diabetics or dysglycemics.
Okay. So there you guys. Did you take notes? Because I know that I get a lot of questions in regards to dirty blood, Pharmacist Ben.
Dirty blood, man. Hypercoagulated blood.
And for those of you that are listening, Pharmacist Ben mentioned several different products that are specifically provided by longevity distributors. So if you were invited by somebody specific, that person may be one of our amazing distributors, and this is a resource for an amazing community. So get back with them and say, hey, Pharmacist Ben mentioned this, 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 and this. And if you didn't take notes fast enough and you're here live with us, make sure you put that chat up, because Marilyn does a fantastic job for you all. That individual that shared this program with you will be able to help you get in your hands the products that Pharmacist Ben mentioned. Now, if you found this program all on your own and you've never spoken to anybody about longevity, you want to speak with somebody, I have a team of certified holistic health coaches available on the Daily with Doc team by calling 855-949-3377. And because we have amazing coaches around the world, we have 24/7 coverage now. So thankful for that. Pharmacist Ben, couple
Yes.
more questions. We've got some hands up, and
Yes.
we only have 28 minutes,
28
more than
big
usual.
minutes.
28 big minutes.
I did a radio show this morning, and the lady says, we're going to do some Q&A, but can you be really quick? I was like, there's no way. You can't be really quick here. Not if you're going to give a real answer. It can't be really quick. So I apologize, but I can't get to everybody, but the people I do get to will be comprehensive, and it's all the same thing anyway, you guys. I repeat myself all the time.
Well, and I know our viewers appreciate how comprehensive you are, because you make it understandable without leaving much out.
That's why you said it, because the job of a good healthcare professional is to get themselves out of the way. I don't want to be relevant. This is about you. You should be doing this yourself, and that's the whole point here. Remember, the word doctor means teacher. Remember that. So I'm not a doctor, but I'm here so you could do this. I don't want to be here. You could do this yourself. And that's the whole goal here. You want to be able to do this yourself and teach your friends, your family, your kids, and your customers and clients to do this themselves.
Absolutely. Oh, thanks for being here, even if you don't want to be. We appreciate it.
Well, it's not that I don't want to be here. It's that I don't want to be Mr. Authority guy.
Right.
Be your own authority. Be your own health authority.
I understand that. Okay, so I've got four questions. We're just probably not going to get to all of them because I want to get to the hands that are up. But I do have this one. I have two women, same household, mother-daughter. Daughter is 34 years old. Mom is almost 60. They're both on levothyroxine.
Levothyroxine, best-selling drug in America, by the way, every year. Levothyroxine, what does that tell you?
Well, we've got thyroid issues, or that's what they're told.
Yes.
But they're on different dosages by just a little bit. Okay. One of them is told not to eat any type of supplements within 4 hours.
Not to eat any supplements within 4 hours?
To take any supplements.
Okay.
And the other one, the doctor says it doesn't matter. Same people, same doctor.
Different days. Same doctor?
Same doctor.
Wait a minute, the same doctor said two things?
Yes.
That's weird, but supplements don't matter. But foods can be a little tricky with thyroid medication. Thyroid medication is dosed in very, very tiny amounts, and it's already pretty ineffective. And the results and anybody who's on thyroid medication knows that sometimes they get results, sometimes they don't, sometimes they get good results, sometimes they get not good results. It kind of changes because the thyroid is very responsive, as it should be, to the environment. So you don't always get the same results with thyroid medication. If you take your thyroid medication with food, it could interfere with the amount that gets into the blood. Because thyroid medication is dosed in such small doses, it may have an effect on how much thyroid medication gets into the blood. So you don't want to take it necessarily with food. Thyroid medication is not a great treatment for hypothyroidism anyway, as people know, and these two gals probably realize. Nonetheless, you don't have to worry about taking with supplements. That's not a thing. Food might be a little bit of a problem. You probably want to take it without meals or without food in your stomach if you really want the best benefits or the best results from your thyroid medication. But supplements shouldn't be a problem.
Okay, thank you so much for that. The next is, I have a client that wrote in and says, why do my armpits smell like dirty French fries, even though I don't eat French fries or fried foods?
That's a great question. Okay. Short answer is the fats in your body are likely becoming oxidized. The classic example of this is a nursing home. You ever go into a nursing home, you know that characteristic smell that nursing homes have? Okay, or even just if you're with an elderly person, that's oxidized fats, rancid fats. That's oxidation. That's cells breaking down, the membranes breaking down, the fats in the body breaking down. The way you deal with that is by protecting the fats, number one. And she doesn't eat French fries, this person, but they may be eating other sources of oxidized fats, of rancid fats. I talked last week, even flour. 1% of flour is fat, is oxidized fat. So, it's not a lot, but it's some. And then, there's other places where we get fats. Also, if the fats in the body are oxidizing just from the heat of the body, just the heat of the body will cause oxidation, which is why you have to have lots of antioxidants in the body. Vitamin E is a very important antioxidant. Phytonutrients, plant nutrients, have antioxidant properties. And then also selenium, the ultimate selenium, is an antioxidant. Vitamin C, of course, is a classic antioxidant, although it's not specific for fats. So it sounds to me like her body, this person's body, is starting to break down, and that is more important to consider, or more important to reverse or to focus on than just the smell. Smell will tend to go away once the body is protected, but that is what that sounds like. I assume when she says she smells like French fries, she means kind of oxidized fats, and that's a sign that she's producing oxidized fats. She's oxidizing.
Okay, so could that be associated with a slow digestion as well?
Absolutely. Everything goes back to the digestive system eventually, but yes, absolutely. It could be things that are not moving appropriately, 100%.
Okay, thank you so much for that. And next, let's go to first hand that is raised. And Zach, go ahead and unmute yourself.
Thank you, Becca and team and Pharmacist Ben. We value you. We appreciate you. Please don't go. We need you.
I'm not going anywhere, but I want you. Yeah, I'm not going to go. I didn't mean to say I'm like
I know. You have helped us and you have empowered us. We appreciate you. Quick question.
Yes.
My 94-year-old father, man, he's doing really good. But they got him on that Eliquis, and they got him with that fear that all the blood clots and then the clots and the clotting of the blood. How can I wean him off?
You can't, and you shouldn't. And we should. Nobody should. We all get to make our own decisions. And I know what you're asking, Zach, because I have, I watched them medicate my dad, and my mom is smart enough not to take any medications, but my dad, and they wouldn't let me give him his Beyond Tangy Tangerine. I had to smuggle it into the nursing home. And I know what you're saying. When you interact with the medical model, you get medicalized. That's just how it is. You go to a doctor, you get doctored. And that's how it is. And everybody gets to make their own decisions. Zach, you're one of the hardest things, and all parents understand this, and even kids now understand this. The hardest thing we have to do is watch our loved ones make decisions that we know are not great. Any parents, you parents out there, you know what I'm talking about? You can't say to your kids, I know better and you got to do this. It doesn't work. People have to do their own thing. And so we have to let people do their own thing. You love your dad. You take care of your dad, you protect your dad, but if he wants to be on the Eliquis, that's his business. There's nothing you could do. Eliquis is a blood thinner. I mean, we've gone through, I don't want to, beat a dead horse here, but blood clotting is a sign of dirty blood, and dirty blood is a sign that something's getting into the blood that shouldn't be there. usually food, sugars involved, injections, through the skin, anything that gets into the blood inappropriately. Also, if you want to help them out without, requiring him to take supplements or disturb his lifestyle, just more water or soups or beyond Tangy Tangerine for that matter. Anything to liquefy the blood as well as if you can get him to do supplements, all the supplements we talked about earlier, the fucoid and sulfate and the Gluco-Gel, et cetera, that helps spread out the red blood cells. But really, your question is good and it's interesting, and I get it all the time. And the answer is you can't tell people what to do, especially old men. FYI, I call that old man's disease. Old men know everything. They know what kind of haircut you should have, what kind of shoes you should wear, what kind of food you should be eating, and where you should be living, and who you should be going out with. That's old man's disease. So old men and old women probably too. So I'm just teasing there, Zach. But you got to let people be.
My father takes the supplements. He takes the Fucoid Z. So if I understood correctly, just keep giving him, hydrate him, the water, the Z radical,
all that. But most
Fucoid
importantly, if there's toxicity that's getting into his body, yeah, you can do some good with the Fucoid Z and other nutrients that help. Essential fats, by the way, I forgot to mention, ultimate EFAs also have a kind of spreading effect on the blood cells. So that's another liquefying, and vitamin E. In fact, doctors will say not to use vitamin E or essential fats when you're on these drugs because they know that they have a thinning effect. So all those are great, but as long as toxicity is getting into the blood, the clotting is a protective mechanism. So the most important thing is to protect against toxins getting into the blood through a leaky gut. That's the most important. But yeah, all those other things are great too.
And he likes to bite into those, and he likes to suck out the EFA. Thank you.
Is that right?
Oh my God! And I'll give him up to 6 and 9 a day.
Give him up to 6 and 9. Look, you're keeping him. He's 94, Zach. You're probably doing some amazing stuff. You're probably keeping him in the game.
And one last thing I want to say, you are right. He did have that smell, and I've noticed it's gone away. Wow.
Praise God.
Thank you, team. Thank you, everybody. Oh my God, it is good info that you gave us. Thank you. Thank you.
Thank you, Zach. Appreciate it.
Thank you, Zach. And next we have AJ.
AJ.
Go ahead and unmute yourself.
So Ben, I'm gonna take exception to something you said. So based on your logic, if my dad wants to shoot crack in the corner, I should just let him. Allow him.
100%. Not just let him. I mean,
do his thing.
Not necessarily just let him, but if he wants to do crack, that's his. It's none of your business. It's his business. Yes, you have to respect people. I believe this is just, you may disagree. I'm not telling you like I know for everybody, but I believe we have to let people make decisions. We have to let people be. And if we think who knows what he has to experience in this, his journey in this lifetime is to experience. Obviously, doing crack is a crazy, stupid thing to do, but he wants to do it. We're using your example. I'm not saying that that's what's happening, but using your example, that's what he wants to do. Who are you to say, don't do it? Who made, my kid used to say, who died and made you king, So,
okay.
All
right. Hey, you point well taken.
He wants to do it.
Point well taken.
It hurts. It really hurt. I don't mean to be dismissive of that because it hurts. I was so ticked off when they were giving my dad the statin drugs, which I knew he didn't need. He already had dementia. They're giving him the statin drugs. But what am I going to do? I argue, fight, tell him not to. That's what they decide to do. You got to let people make their own decisions, even if you think and that they're not good decisions for them. You got to let them be.
So I'm going to ask my question. It's to do specifically with a client who has dirty blood, has dysglycemia, has
you throwing those big words around.
I learned from the best, and she has she's 100 pounds. She has the clinical diabetes, and I got her on Start Pack, Ultimate Microbiome, glucogenics, and she noticed that her blood sugar is increasing
more fluids
about 4 days.
Well, I've heard occasionally that happens, but I don't attribute it to the supplements. I would attribute it to what she's, sugary foods, or foods that are breaking down the sugar. I would not attribute it to the supplements, but more fluids. That's the solution to that. Do you understand? When we talk about blood sugar, we're talking about blood sugar concentration. So in other words, high blood sugar means a more concentrated blood sugar. It means you have more sugar per unit of blood, per milliliter blood. By diluting it, by drinking water, you dilute it. You put more fluid in the blood. So the sugar stays the same, but the blood, the bottom of the ratio increases. The bottom number increases. So the same sugar stays the same, but the fluids increase, which drops the concentration. So that's the strategy that you want to use for that. Anytime the blood sugar rises, think about dilution of the blood. Also, forgot to mention this, movement shuttles sugar to the muscles out of the blood. So physical exertion, you've heard sitting is new smoking. This is one of the reasons why movement is so important, because it drops the blood sugar. This is, by the way, is especially important after you eat a sugary meal, or after you eat any meal, really, to move the body so the sugar will, the sugar will not stay in the blood. It'll get shunted into the muscle. And that's another strategy, have her doing some exercise or some movement. But I would not attribute it to the supplements, A. And even if it did, you need the supplements. Figure out other ways to drop the blood sugar. I'm sure she's not eating pristinely. I'm sure she's not eating perfectly,
They're trying.
Sugar. What's that?
They're making a good attempt.
Changes. They're making changes, probably, yeah. But there's still places to work. That's where you want to work, not on the supplements.
Thank you, Pharmacist Ben.
Thank you, Mr. AJ.
All right, and Pharmacist Ben, next question. So we have a coach. She has a client that is treating tinnitus, or she got tinnitus after being given doxycycline.
Doxycycline. Okay. Yeah. That's interesting. Doxycycline will cause a very interesting condition in the brain, in the head, that can affect the brain, which is intracranial hypertension. It increases the pressure in the head in some people. And tetracycline can do this too. And, if you go to the medical people, they'll say, well, we don't know. And really, it seems kind of mysterious. But as it turns out, dysbiosis will do the same thing. In other words, messed up gut bacteria also, in some people, can raise intracranial, can cause intracranial hypertension, can raise blood pressure in the head. When the blood pressure raised in the head, that can affect all kinds of things, including hearing, vision, and there are some people get vision loss, and sometimes it can be permanent. Usually it's reversible, or it goes away, I should say, when you stop the medication. Some people it doesn't, depending on how far progressed. So I'm not saying that's exactly the mechanism, because really it's kind of unknown, but given the fact that our triangle of disease, that's a principle, that's a law, everything backtracks to those two main points, and given the fact that we know that dysbiosis or disturbances in gut bacteria can raise blood pressure in the head, it's very likely that that is at least partially the cause. But to answer the question, it goes away for most people, when you stop the meds. Sometimes it takes a week or two for it to go away. It'll go away when you stop the meds. And then also, when you're using your doxycycline or tetracycline, and any antibiotic really, you should be using probiotics with it. Not at the same time, because the antibiotic will kill the probiotics, but hours after you take the antibiotic, you want to take the probiotics, or when you're done with your antibiotic round, take the probiotics, and that may make a difference as well. And just generally correcting digestive health. And I would ask these patients if they have noticed, when they took their doxycycline, digestive health issues, bloating, gas, diarrhea, all the the usual digestive symptoms that we talk about, and that will make it more likely that that's the cause. So I want to talk to those people, but I'll tell you that dysbiosis is known to cause increases in intracranial pressure, or intracranial hypertension, as they call it, as is doxycycline. So it's very likely they're related, given the fact that doxycycline kills bacteria.
All right. And as far as the probiotics from longevity, there's the
Nightly
digestive
essence is my
effects,
favorite. Yes. Oh, but I
nightly
forgot to mention,
essence.
yeah, the enzymes, ultimate enzymes on an empty stomach are a great way to fluidize the blood, to they act as anti-inflammatories for the blood on an empty stomach. And there's a really cool enzyme in the nightly essence called nattokinase, which has been used actually therapeutically to clean the blood.
All right, perfect. Let's go over to Henry. Henry, go ahead and unmute yourself.
Hi, good afternoon. Thank you. Quick question. I'm in my late 50s and I am taking Tasty Tangerine. One of the things though is I've just noticed that, usually after I finish, working towards the end of the day, I'm just very exhausted. And then sometimes when I get up, I'm exhausted also. I am a type 2 diabetic, but my A1C is under control.
But the metrics that they give you, you can't really go by that, because that doesn't, and when you say it's under control, that just means your metrics are right, but we don't know what's doing to you. So there's lots of things that can be causing that. Diabetics, by the way, are more at risk for something called sleep apnea. Have you heard of this?
Yes, I am on a CPAP machine.
Well, there you go, buddy. You answer your own question. You're not getting quality sleep. Now, the CPAP machine probably will help, but you're probably not getting enough oxygen, even when you're not sleeping. CPAP machine, for those who don't know, increases oxygen pressure into your lungs when you're sleeping. People have sleep apnea, don't get enough oxygen when they're sleeping, and that can be a serious problem. But if you wake up in the morning not rested, and you have a history of either cardiovascular problems or blood sugar problems, the chances are pretty good you're not getting oxygenated as you sleep. And that's, if you're type 2, I think you said you're type 2 diabetic, that is almost certainly at least part of the problem. But fatigue is just a generalized symptom. It's hard to pinpoint exactly what's causing the fatigue issues. It could be many things or a combination of things. But as with all health challenges and symptoms, triangle of disease, digestive system, blood sugar system. And then if you want to work on the third point, that even though we've truncated our triangle of disease to the line of disease here, the adrenal thyroid complex. I would also be practicing slow, deep breathing. That's another thing that you could do. And then if you're not already, something called high exercise, but a specific kind of exercise called high intensity interval training. Have you heard of this? HIIT training or HIIT exercise? Yeah. And for anybody out there exercising or doing exercises, that's the best way to exercise, is bursts of intense exercise and then stop, rather than trying to take some people say they exercise, they take a walk around the block or the park. The body likes intensity, but not long-term intensity, bursts of intensity and then rest. So that's another way that you can improve oxygenation. And then also, because oxygen is delivered, fatigue, by the way, oftentimes is linked to oxygen. I forgot to mention that. Another way that you can improve oxygenation is to keep the blood flowing. If you're diabetic and you have, I don't know what your the test. Who asked that question? Henry?
I have a constant glucose monitor, so Dexicom.
Okay, keep track of that. Absolutely keep track of that. But the hemoglobin A1C test is a marker of dirty blood. Diabetics are especially prone towards dirty blood because sugar reacts with the blood. And then insulin can affect the inside part of the blood vessel, causing it to become thicker and inflamed, and that can also impede the movement of blood. So the hemoglobin A1C test is a measurement of how fast the proteins in the blood are clotting up. Hemoglobin is a protein, and the hemoglobin gets technically they call glycation. You may have heard that term. It gets sugared, candied. Sugar reacts with it, and that will cause the blood to become clotted and sticky. So even if your hemoglobin A1C test is normal, it may not be normal for you. It may be normal for the reference range, but you still may be having a problem that way. So keeping the blood flowing more effectively with all of the strategies we talked about today, that's another thing that you might want to consider.
Okay. All right. Thank you.
Okay. Thank you.
All right. And I am frozen.
You are? We see you.
Oh, you can still hear me?
Yeah, I see you.
Fantastic. Can somebody please ask Colleen to unmute and ask her question? Because I can't.
Hi there. Yes, I have a client who said that she thought she was having a heart attack, so she went to the ER, and he didn't even run an EKG and told her that she severely strained a tendon or a muscle or something.
Really?
And she didn't necessarily feel right about that. So the question is, except I heard recently Dr. Joanna Conway say that a lot of women have heart attacks and don't even realize it. So if it's possible that she did have a heart attack, is there something that she can do to help heal from that?
Well, there's 100 things she should be doing.
Mm-hmm.
You know, and it's things we all should be doing, but she should be doing with much more vigilance. And yeah, there's lots of things. Healthy brain and heart pack, first of all. I mean,
Okay.
that's a must. The main reason or one of the main reasons, a lot of reasons for cardiovascular health problems is sugar, glycation, dirty blood.
Mm-hmm.
Also, the heart depends on the connective tissue to be fed, and like all parts of the body, our heart depends on the connective tissue. So once the connective tissue deteriorates, cardiovascular heart and blood vessel issues are likely. And so working on connective tissue, that's the healthy bone and joint pack. Working on digestive health. There's a whole bunch of things. Oxygen is very important. But if you want to simplify things, because they can get very complicated, I would be putting her on the healthy bone and joint pack, and then throwing in the Sweeties and probably the ultimate niacin, which I'm not sure. Is that in the healthy? I don't think that's in the healthy brain and heart pack, the ultimate niacin.
No.
I'd be throwing that in, as well as the Osteomag and the Fucoid Z. And also being very careful with foods for the whole dirty blood connection. But yeah, tons of things.
Thank you.
Great question, Colleen. Thank you so much. And Albert, if you could spotlight yourself and ask your question, please.
And can somebody spot Ruth Ellen, could you spotlight?
Recording stopped.
Hi, Ben. Pharmacist Ben, can you hear me?
Recording in progress.
Yeah, loud and clear.
Okay, great. Thanks.
How's your pet zebra doing today?
Yeah, good. They were blocking my way when I was going out yesterday morning.
Is that right? Zebras?
Yep.
Oh, that's cool.
Yep. I'm going to send you photos sometimes.
All right. Where are you? Right in the jungle? You're in South Africa, right?
Correct, yes.
Is the jungle
but
in
I
your
stay in the
backyard?
bush, so
What's
say
that?
again?
Is the jungle in your backyard?
Correct, yes.
Oh, that's awesome. That's awesome.
Yeah.
All right.
Right. What I wanted to ask is, if a client has been told that they've got a severe parasitic infection, what can we do, or what could they do to?
Yeah, if it's really, I hear about parasites all the time. It's kind of a thing. Parasites actually live in your body normally, so it's hard to really blame parasites for things. But there are severe parasitic infections, obviously, especially in third world countries and other parts of the world. So it could very well be that that's the case. Anti-parasitic medicines, pretty much. Parasites you're not going to eradicate a parasite with nutrition. Parasites are invasive creatures, I guess you could say, that have been designed by evolution to be able to thrive in your body. So you're not going to be able to nutriate parasites out of your system. You can try things like charcoal, zeolite, bentonite clay, but really, if it's a serious parasitic infection, you don't want to mess around with it. And anti-parasitic medicine is the way to go, like ivermectin. But it's not really that's not really a nutritional issue. That's an infectious issue.
Infectious, okay.
Yes.
Great.
Yes, thank you.
In South Africa, we'll say buy a donkey.
Buy a donkey? Is that what they say?
Yeah,
Albert, when you go to work in the morning, do you have to dodge lions and cheetahs and you have to run around, make sure you don't get bitten or eaten? I'm just kidding.
No, not lions and cheetahs, but we do have leopard and hyena around and jackal and things like that.
Yeah, jackals at night. You see the jackals? We got jackals here. They just work for banks. All right, just kidding. I was just talking to my banker today. That's what made me think of that. All right, go ahead.
Super. Bless you, Ben. Thanks a lot for
everything. Thank you so much. Yes, Becca.
All right, if somebody could please put me up again. I
I'm
don't know
gonna turn
what
into a
happened to my
pumpkin.
computer.
I'm about to turn into a pumpkin, Becca.
You
Yeah.
are.
I'm
Yes,
about
you
to turn
are.
into.
So
know-
we need to get all the co-hosts up on the screen with us as we are at the end of our show. Thank you so much, Pharmacist Ben, for
Thank
being
you.
here with us. We greatly appreciate you sharing the knowledge that we too can be knowledgeable.
Yes.
And that's important, because if we make decisions without having any type of knowledge or information behind that decision, how do we know we're making a brilliant decision, right? So I don't know if I froze again, but we just want to thank each and every one of you watching us on the live stream, watching us here in the Zoom room, for taking this time investing in yourself, as that is one of the most important investments of all for today and your future. So we couldn't do this program without our co-hosts. We have Albert joining us from South Africa. Thank you so much, Albert. We have Ruth Ellen, who is my executive production manager, helping to keep everything rolling along smoothly. We have Marilyn, who is doing a fabulous job putting notes in the chat for each and everyone in the Zoom. We have Kaylee, who is part of our social media marketing team. Thank you so much, Kaylee, and thank you, Marilyn. We have AJ, who is our marketing guru, helping us to get out on all the different platforms for people to see us. Now, get back with the person that shared this program with you, because they cared enough about you to make sure you have information to help yourself. My name is Becca Dukes, as the Director of Student Services for the Institute of Holistic Health. If you'd like to find more information out how you too can become a certified holistic health coach, go to coach.dailywithdoc.com. Pharmacist Ben, you're amazing.
Thank you, Becca. Nice to see you. It takes one to know one. Don't ever forget that. Everything you think about me, you got it yourself. All of you. Thank
Awesome.
you.
Well, thank you, thank you, thank you. And that goes for each and every one of you watching today. Until next time, bye for now. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.